No need to call a doctor or midwife telling them about how nauseous you feel in your pregnancy, or the frequent heartburns that you experience around 20 to 40 weeks in your pregnancy, or even by the end of this video, you'll be able to manage some of the minor ailments or disorders in pregnancy. Hi, if this is your first time seeing my face here, I'm Fubiwa and I'm a midwife. Pregnancy is coupled with a whole lot of hormonal fluctuations, which can cause changes in organs and how they function. They say pregnancy is not sickness, but I say that pregnancy can make you feel sick. Because mama, tell me why your favorite perfume now makes you feel nauseous. Some of these ailments or disorders pre-exist before your pregnant state, but they are aggravated by your pregnancy. This include vaginal discharge, popularly known as leukorrhea, hemorrhoids, skin changes, sleeplessness, backache, constipation, and flatulence. Some of these disorders only emerge as a result of your pregnant state, and this includes heartburns, abdominal cramps, excessive saliva in the mouth, popularly known as tylism, craving for non-nutritious diet, what we midwives call pica, nausea and vomiting. And the last one is frequent urination. If I didn't mention any of the ailments or disorders that you're experiencing at home, mama, you can put it in the comment section so that in my next video, I'll address them. Starting with nausea and vomiting. Nausea and vomiting is usually common in first-time mothers, and it usually occurs in the morning. Hence, it has been nicknamed as morning sickness. Now, what is causing you, mama, to feel nauseous and feel like vomiting? 1. The smell of certain foods and some perfumes can trigger nausea and vomiting. Sensitivity to motion. If you're super sensitive to motion, it can also trigger nausea and vomiting. Elevated levels of pregnancy hormones can equally cause you to feel nauseous and feel like vomiting. Fatigue, stress, and anxiety can equally cause nausea and vomiting. Now, let's look at how you, mama, can manage this at home. The first one is avoid food that is soaked in oil, which is oily or fatty foods. Try as much as possible to eat dry foods such as dry toast and dry biscuits. Mama, maintain oral hygiene. Do your best to brush at least twice a day. You can use some of these mouthwashes. In a typical Ghanaian home, people prefer the chewing stick. You can equally use that. Avoid sudden movements. Move out of bed slowly to prevent nausea and vomiting. Mama, do not skip a meal as this can equally trigger nausea and vomiting. Drink a cup of ginger tea before meals. I learned that mint tea equally serves the same purpose. So you can look at the one that is readily available to you and take it. The next one that I'll talk about is excessive saliva in the mouth, popularly known as tylism. This is caused by increased levels of hormones produced in pregnancy, and it can be managed by 1. Maintaining oral hygiene, and the second one is identifying precursors and avoiding them. For instance, if the smell of a particular food or perfume causes you to produce excessive saliva in the mouth, you can identify them and prevent them. If the sight of animal feces causes you to produce excessive saliva in the mouth, you can equally avoid these things. Now, moving on to the next one, which is flatulence. Mama, if you are farting more than 10 times a day in your pregnancy, then we need to talk because you cannot be killing that man with fat. Let's look at some of the things that causes you to give off excessive gas. 1. Swallowing too much air, either through talking or eating. 2. Eating certain types of food such as beans, eggs, and yam. 3. The pregnancy hormone progesterone relaxing the smooth muscles in the intestine, causing food to stay in there for long periods. This can equally cause you to give off excessive gas. The last one is procrastinating elimination. How do you manage this at home, mama? 1. Omit gas-producing foods like I mentioned earlier, beans, yam, and eggs. Exercise regularly and eliminate regularly. Mama, make sure to eat a lot of fruits and vegetables as this can help you to eliminate frequently. This is why you have to be watching this with your partner so that he will understand the situation at hand and not blame you for giving off excessive gas. The next one that I will talk about is backache. The main reason why you are experiencing backache in your pregnancy is due to the weight of the uterus pulling the bone at your back forward and changing its natural curve. Backache is usually increased or worsened when you, the pregnant mother, wear high heels or gain excessive weight in pregnancy. Now, mama, let's look at how we can manage backache in pregnancy. The first one is you make sure to get a comfortable mattress. Second one is you get a chair with a back support as this will help to prevent backache. Third one is make sure that you get enough rest within a day, resting not less than 8 hours per day. Mama, get a massage. This will help relieve your backache. And the last one is make sure to have your knees bent while you are lifting an object. The next one that I will talk about is craving for non-nutritious diets, what we midwives call pica. The actual cause of pica is unknown, but we midwives believe that since there is changes in metabolism, which is right now you're not digesting food for your body alone, food which you take in is equally absorbed by the baby, and this will cause you to crave for non-nutritious diets. Some people wholly attribute pica to nutritional deficiencies such as zinc deficiency. How do you manage this? Mama, at this point in your pregnancy, you should be able to choose between the health of your baby and an unhealthy craving. It's crucial to note that in early stages of pregnancy, nutritious diet is essential for the development of the baby, and you need to choose healthy foods to maintain the growth and optimum health of the baby. Your partner can equally help you to prevent pica by reminding you of the reasons why you need to take in healthy and nutritious diet. The last one that I will talk about is heartburns. Now, heartburns is usually felt around 20 to 40 weeks in your pregnancy. And mama, let's look at what is actually causing this. The first one is the pregnancy hormone progesterone, relaxing the cardiac sphincter and causing food to move back into the esophagus, causing irritation and pain. The second one is the weight of your uterus compressing against your stomach and preventing it from emptying. This will cause food to eventually move back into the esophagus, causing heartburns. Now, mama, let's look at how you can manage this at home. The first one is you make sure to sit up after you have finished eating to enable the food to digest before you lie down. The second one is avoid eating spicy foods. And the next one is, mama, make sure to avoid taking alcohol in your pregnancy. The third one is eat small and frequent meals, as this will enable proper digestion and prevent heartburns. The next one is sleep with more pillows, and the last one is avoid bending down during household chores, as this will help to prevent heartburns. If I didn't mention any of the ailments or disorders that you're experiencing, do well to put it in the comment section so that I'll talk about it in my next video. So mama, you have learned how to manage 6 major disorders in pregnancy. The first one is nausea and vomiting. The second one is backache. The third one is heartburns. The fourth one is pica, which is craving for non-nutritious diets. We have learned how to manage flatulence. For this and more videos, kindly subscribe to my channel and stay tuned.